All right, not a real big area, but we got in here. We got a good pilot with us today to get us into spots like this. Clark, I don't know if you heard earlier what I said. He used to fly the George W. Bush. You know,
that's what Tim said.
Yeah.
It's not going to work. He's
So,
got a little experience.
I guess if they trust him, I should trust them, right?
What's your role? You a pilot?
I'm a flight nurse.
Yeah. Okay.
Been with REX, let's see, probably 12, 14 years, somewhere right around there. Yeah. So
working on Rockford.
Out of Rockford, and now we're part of Air Methods. You know, so the helicopter is still like with the hospital, but we're now part of Air Methods. Like the pilots have always been part of Air Methods. So I worked for the hospital for 20 years prior, you know, including the time with REACT, and then now we're over with the Air Methods is our employer now. So
how often do you guys go out in one of these to do a rescue or transport?
We average about 2 flights a day. You know,
really?
So obviously some days are busier than other days. You know, but that would be our average.
What kind of geographic area do you guys cover?
We'll go anywhere from. We'll go anywhere. I've gone even up to Rochester, but most of the time what we fly is, you know, like from Madison, Chicago, Iowa, you know, the border right there, and south. We'll go down to Peoria once in a while, but most of the time, like say Dixon area, there's other aircrafts in the area that can usually take up, you know, fill in those other areas that we're not going to. So, but that's our general area.
Got a pretty wide swath.
It is, yeah, right, yeah. But like from here to Rockford, you're talking a time frame of about like a 20-minute flight. You know,
one way.
One way, yeah. So if you had somebody that was a crash scene, you know, a farm accident out in the field, even a medical scene, you know, somebody had a heart attack, we could be there, pick that patient up and have them back to Rockford, you know, in 20 minutes. We also transport patients from hospital to hospital. So maybe we go from here to Chicago or from Rockford to Chicago or Madison. We do that as well. You know?
Is it the rescues or the transport system the most common?
We do most of what we do is critical care transport. You know, hospital to hospital. Anything like anything from little tiny babies, you know, premature babies, pregnant moms that are at high risk, crash scenes that we'll do, and like medical, pediatric, or adult, you know, that are like intensive care type patients, you know. Yeah, this particular aircraft has a lot more like updated avionics in it. So it has autopilot in it. It has weather, train avoidance. It has like we can see cell towers and different things like that on the radar on this thing. So there's a lot of advancements in the aviation part on this helicopter. So it's a good helicopter in that regard, you know. As you've seen, not a lot of room in the back, you know, but it gets the job done what we need to do. And our number one thing that we do is rapid transport. That's what we're about, you know, getting a patient from point A to point B as quickly as possible.